Well, welcome everybody. Thank you so much for joining us. I'm Nurse Danie. It's Dr. Ryan. Dr. Ryan is our in-house board-certified doctor in anti-aging and integrative medicine. He is also a doctor of acupuncture and oriental medicine. Say hello, Dr.
Hello. Hi, everybody.
All right, so some stuff that we're going to be talking about today, very exciting, women's health, women's hormones, and how that affects our day-to-day. All right.
Yes, we will.
Okay, so tell us, Dr. Ryan, a little bit about hormones and how they play into our day-to-day.
So hormones affect pretty much every feel and function of our body, from really the time we're born and until we say goodbye. Our hormones are functioning and flowing and creating every aspect of our being. So we think of hormones, of course, at first during times like puberty and times like menopause. But hormones play a role in everything from metabolic function to thought.
Yeah, energy, mood, right? Like
Absolutely.
Skin. I have a huge background in aesthetics and never really was able to put the two and two together until I joined, our practice and was able to really learn a lot deeper how that affects the skin and how that affects just your results in even getting treatments, right? So it's wonderful, knowing that there's an internal component that contributes to our overall health, right? Things like sexual function and our ability to regulate our mood and our energy and all of that. Brain function, right? So brain fog, moms, I'm here with you.
Absolutely. I mean, there's when we're doing our consults, whether they're wellness consults or aesthetic consults, I know in aesthetic consults specifically, Dr. Josie talks often about the breakdown of collagen and elastin in the body and how that relates to the aging process and drops in hormones, specifically estrogen. And it's kind of an easy handoff to a conversation about, well, what else could be going on in the body? What else, may be breaking down and may need to be modified or enhanced a little bit in order to make sure that we achieve the best results.
That is
when you're talking about mood, it's funny, I read a very funny comic strip. I don't know who the artist was, it was a while ago, but it was a take on the Seven Dwarfs, but it was the Seven Dwarfs of Menopause. And they were just listed as, itchy, bitchy, sleepy, angry, hot, sweaty. I mean, it was so funny.
But it's true though, right? And I think that not even just menopause, you can throw that to a postpartum mom who's like, what is going on with my body? Or you can do a 13-year-old who just got her period for the first time and she's like, what is this? What is going on? But yeah, I mean, it really does affect every aspect of our life. One of the questions I get a lot is it really just impactful during those moments in our life where we're doing this pivotal change, right? Puberty, postpartum, menopause. But it's not just those times that those kind of affect our day-to-day. That's just when we tend to notice it a little bit more.
I think that's when we notice it more because that's when we have the greatest extreme, when we're at like a normal for a while and then we have this upheaval or this drop, right? So whenever you figured out a new norm, a new status quo, when something changes is when it's noticeable. What we hear actually mostly, which is, probably of a patient's concern more than ours, is that once everything's regulated, as we continue to treat, patients are like, well, I don't feel any different anymore. And that's because we figured it out. That's when we started to regulate hormones appropriately and you're not having those ups and downs. But at the same time, we want to make sure that people are feeling their best. We don't just want normal, we want optimal. So we have to figure out what that sweet spot is too.
Right. Another, just thought on that is, getting to optimal. What is that? What does that process look like? What are we hearing in practice, or what are you hearing? Because you hear it, most. I hear it and then I say, see, Dr. Ryan. But what kind of symptoms are people coming in and presenting with that is making them curious, saying, why, what's going on, those kind of things?
Honestly, those Seven Dwarfs are pretty common.
Okay.
Foggy also is one that we hear a lot. A lot of it is, I don't feel like the way I used to. And they can't always pick it. It's sluggish, it's angry, it's tired, it's fat, it's bloated, it's dry.
It's women's intimate health, right?
Oh,
I think that's a big
painful
one.
intercourse, low libido,
urinary incontinence. So that I always say, think like sneeze, laugh, jump, pee.
Yep.
Yeah.
Yeah, that's exactly what it is. And that starts early. That's like high school athletes. That
Totally.
starts very early, and really is something that needs to be treated. There are things like that, like we offer Viviv.
Yes.
That there are treatments that really work for that, and it isn't always just age related as much as it's function related. Hormones are certainly involved, especially when you're looking at something like lubrication,
Right.
something like libido. We can't improve someone's interest in their spouse,
Right.
but we can certainly
This is totally
improve their
true.
interest in sex in general.
Right. Absolutely.
Hormones make up how you think and feel. It's going to make a difference if you have no testosterone versus some testosterone versus optimal testosterone.
Right.
It's going to make a difference if estradiol and progesterone are in the right balance versus one being very high
Totally.
and feeling very busty and bloated versus another one being very high feeling very fatigued.
Right.
It all depends on what we're really
I think
looking
it's
for.
so fascinating that, someone, let's say, for example, myself, and I think this is easy because it is a very common topic, as I've learned. I'm hoping it's common. Dr. Ryan told me it's common, so I'm hoping everybody can relate. But, when I started learning about this, I thought testosterone is a male hormone. Estrogen is a female hormone. I didn't know that there was supposed to be a balance. I didn't know that you could get normal thyroid readings on your every annual visit with your regular doctor, but there could be something off. One of the things that I would always have dismissed is brain fog and exhaustion. And I know maybe I come off with a lot of energy, but I will tell you guys, I feel differently in my 30s than I did before. And I hate when people say it's your age. Right, I know that that's a contributor, but it's like this night and day difference. So can you tell us a little bit more about, well, first part of the question is, how are these hormones actually male and female hormones in general? And then also, what kind of labs do we run in our practice, that sets us apart and is able to give us this deeper dive, this true, customized, very comprehensive overview of the person sitting across from you?
Okay, so a few things. One, I want to touch on something you said about age, because that is a very common thing. People say over and over again, is it my age? My doctor says I'm just getting older and get used to it. That's not an excuse anymore. When we talk about anti-aging and longevity medicine, you can be old and feel awesome. It has nothing to do with age. You can be young and feel terrible.
Right.
Certainly, hormonal changes occur during the aging process, but there are optimization techniques that can make you feel, high vitality, high energy, and high interest. Second, normal ranges are based on age group and gender. And they're there in order to make sure there's nothing so far outlying that there may be a potential disease state that needs to be treated,
Okay.
or be a real problem other than I just don't feel well and I want to feel better.
Right.
Which is a real problem, but less concerning, right?
Right.
So the normal ranges were established so long ago and very rarely changed because it takes an entire association's board to sit down and have a conversation and make these decisions, and it's like, all right,
It's
so
been
these
working,
five,
right?
so these five, old white-haired men are going to sit down together and tell you what your estrogen level should be.
Yeah.
And I don't know
No,
if
thank
that's
you.
really the case anymore. I mean,
Right,
now it's
right,
all right. When did you feel best? Do we have labs that match that? What was your life like? What was your diet like? What was, did you take different medicine at the time? When did your mom become hypothyroid? When did your grandma ever did grandma go through early menopause? Like, there's all those questions. I want to know about you and figure that out. And then the whole idea of women and not having testosterone, that's just insanity, and that's just old medicine. I mean, women make testosterone just like men, just at different levels and at different times. Men's testosterone peaks between 6 and 9 a.m., and it's usually a noticeable peak if they're healthy, right? Women's testosterone peaks at night. So there's a mismatch right there. So you have to know what you're looking for, you have to know what type of symptom matches, and you have to figure out that sweet spot in the normal range that works for you.
For that patient
a
individually.
400% normal range, you might be in this tiny little 10% that was where you feel your best. And that takes a little bit of time. Sometimes it takes 3 months, sometimes it takes 12 months to figure out, but we will keep digging until we get there.
Okay, I love that. So lab work that we do in our office, I guess a little process in how we introduce someone. You know, we have a lot of wellness patients and they speak our praises, which is wonderful, but someone who's nervous and wants to get started, what's the first step? I mean, outside of calling and saying, hi, I'd like to meet with Dr. Ryan, what does that look like in the first visit? It can be intimidating.
Oh, for sure. And I mean, the good news is, like, you're meeting with people who do this all day, every day.
Right.
We have these conversations whether patients are here or not, right? I mean,
Right.
we're literally in this for the long haul. We're interested in it. We like it. And we're used to seeing any symptom, not just what we've talked about, but also, you know, the way far outliers. So there's nothing we haven't heard. It's really just more of a casual conversation. There's some paperwork, there's some questionnaires, there's this stuff that guide you into, you know, into the conversation, and the education starts even with the paperwork. I mean, it's some work. I mean, we're asking you some questions that you're not used to answering, you're not used to thinking about, but you might learn, oh, I didn't even realize that was a symptom.
Totally. How many times have we had someone say, this is so much paperwork, but then realize, like, oh my gosh, why do you care? Because it contributes to your overall health. Because it contributes to your skin. It contributes to your sexual function. I mean, it literally, it contributes to why you have hair growth in that area or why it's so stubborn. So I think it's all, you know, very, very helpful in creating a customized, very unique experience for the patient. Right? Because we don't cookie cutter anything.
No, I mean, there's certain things that happen that are, you know, a more like structured, professional approach. We're going to take your blood pressure, we're going to check your heart rate, we're going to take your temperature, we're going to put you on a scale, but we're going to check your body composition. We're going to see if you're storing fat in areas that maybe you shouldn't be storing, or maybe it tells us about what is going on with you because you're storing in certain areas. We're going to look at resting metabolism. We're going to talk about inflammation, metabolic function, things that are also involved in aging and hormonal function. And through that, we come to a care plan that's going to optimize the way you feel.
Yeah. One other thing that I'd like to touch on is, right, someone comes in, we're optimizing them. And let's say that there's someone younger, right? We have a lot of, you know, younger clientele now that are very aware of their body, very aware of their skin, and wanting to preserve hormones, youth, longevity, vitality, all of this, right? So what are some steps? I know that you know specifically some things that they can do supplement-wise, hormonal-wise, but what are some steps that they can do to maintain and preserve the hormonal function in their body? You know, what are some of the big do's and don'ts, rather?
The very first thing that I lean towards when talking about optimizing health while you are young is diet and exercise. And I know that sounds boring, and I know that sounds cliche, but if you can limit big swings in blood sugar.
So don't live off Oreos and only run marathons.
I would prefer not running marathons because I think that might hurt. It might age you faster. I would go with resistance training and hit intervals.
So basically do everything that builds muscle that I can't actually do.
Right.
Great. Wonderful.
I mean, but realistically, if you're already healthy, and whether you're young or aging, doesn't really matter. The goal to preserve that healthy life, that improve that healthy lifespan, is going to be built around the same form and function, but we can't always see it the way we see in labs, where it's, you know, it's literally in color in front of us, where we can see what's going on. But when it's, you know, when it's you, it's how do you feel when you wake up? How do you feel at 10 a.m. and 2 p.m.? How do you feel right after you eat? How do you feel when you work out? Are you winded? Can you go upstairs? Can you stand up from a seated position without having to push yourself up? Do you have back pain when you get out of bed? I mean, these are like activities of daily living. Those things tell me so much more when we're just trying to figure out, all right, where do we start?
Totally. I think that's so great. Well, I think we've touched on a lot of things outside of just having, you know, your expertise here in guiding patients. We offer an array of different services, right? Like hair restoration, Vivive, skincare treatments, body, you know, weight loss programs. So there's so many things that we can address. The first step is just identifying what the patient's goals are, right? Absolutely. And then kind of navigating that first couple months of let's get you feeling good, and then let's address some of these concerns and start taking care of them, right? Because it's all about look good, feel good. I love it. All right, well, thank you, everybody. If anybody has any questions, please feel free to comment. We will try our best to get all of those answered. If you have any more private questions that you'd like to ask, feel free to send us a private message or text our phone number. We'd be happy to reach out and just answer or help answer those questions. Make sure to visit our website and subscribe to our newsletter. Dr. Ryan shares a lot of really awesome information every month, and we also have the aesthetic newsletter. So we look forward to seeing all of you. Thank you so much for joining us today.
Bye, everyone.
That was timed.
Yeah.